All right, from texting to typing on keyboards and even old age, our hands and our wrists endure a lot in our lifetime, making injuries to our wrists and hands a problem for a lot of people, and that, of course, can lead to arthritis. Joining us now with more on our Healthy Living House Calls is Dr. Joseph Robison, orthopedic surgeon at Florida Hospital Kissimmee. Doctor, thanks for coming in today.
Thanks for having me, John.
Coming in. Let's talk about this. Are you starting to see an increase in people experiencing hand and wrist problems as more people use keyboards on a day in, day out basis?
I really am. And I don't think it's just keyboards. I think it's cell phones, video games, lots of texting. We're really using our hands more and more now for things that maybe they weren't really designed to do, and we're definitely starting to see more problems from that.
What about at younger ages? A lot of times in the media we hear stories that, wow, so-and-so has a young kid who has carpal tunnel syndrome because he texts all the time. Is that stuff true or no?
Yeah, I don't know if it's exactly true in terms of carpal tunnel syndrome, but I definitely see more younger and younger people who have problems and pain in their hands and wrists, and I really think a lot of it has to do with that they're using their hands a lot more.
How do you know when it's becoming a problem, as opposed to, man, my hand's just sore today?
Right. Typically it's becoming a problem when it goes on several days in a row, when it gets to the point that you have to stop what you're doing to let your hands rest on a more frequent basis. Then it's definitely becoming an issue.
If parents are concerned about their kids doing this all the time, should they cut back? Should they put restrictions on it?
I think that's a good idea, even for other reasons than just the hands. Certainly you want to limit computer use, video game use, cell phone use to help your hands, but certainly I think limiting that time in a day has other benefits, just to spend time on other things.
I'm glad you brought that up, because I don't know how old you are. I assume we're pretty close in age. I remember it was the big rage back in the 80s, the Atari thumb. How you sat there all day.
Yeah, Space
My
Invaders
thumb
wrist.
Still hurts. I mean,
yes.
What, 30 years later? Kids have different games these days. Same kind of issues that they're facing?
You know, not quite as much, and I think part of that is because a lot of the modern video game controllers are much more ergonomic. They fit our hands much better. They're better designed. If you remember those old joysticks where you kind of gripped them in your hand and those type of things. I think that there is less of a problem because things are designed better, but again, even if you use something that's designed well 5 or 6 hours a day, it's going to ultimately catch up with you and give you some problems.
I truly do not know the answer to this, but if you do develop carpal tunnel syndrome or other problems from typing or texting, are there treatment options, or once you have it, you have it?
That's a great question. There's actually lots of treatment options, and it really depends on how bad the person's symptoms are and how long they've been going on. Cases that are very mild, that have not been going on a long time, can sometimes be treated with activity modification, changing the workspace environment, making sure a keyboard and a desk is set up properly. Anti-inflammatory medicines can help with that, braces, if the symptoms are mostly at night. As the symptoms become more severe, if they've been going on for several months or a few years, you start to get to the point where you have to think about things that are a little bit more invasive, cortisone injections, and then possibly even surgery.
All right, it's interesting, and we're going to ask you to actually log on to your to our website right now, right? They can chat with you, so we're actually forcing them to use their fingers
Exactly.
more.
Make sure it's set up right.
All right, again, Dr. Joseph Robison with Florida Hospital Kissimmee. You can go onto our website right now, myfoxorlando.com. He'll be doing a web chat, so any questions you have about these kind of things, log on right now. He'll have some answers for you. Doc, we'll talk to you in just a minute.
Thanks, John.
Thank you, sir. Appreciate it. It's 9:44 here on Good Day all morning long. Dr. Joseph Robison, orthopedic surgeon at Florida Hospital Kissimmee, has been answering your questions about hand and wrist injuries. All right, so what are people asking? What's the number one question so far?
Well, the number one question I'm getting so far is, what exactly is carpal tunnel syndrome? It's something that we hear about a lot and is talked about a lot, but sometimes exactly what it means is not that clear.
Yeah, what is it? You know, it's funny, we make jokes about it. Grandma had it. You always hear these stories, but nobody knows what it really is.
Well, what carpal tunnel syndrome is there's a nerve in the hand that goes to the thumb muscles, the pointer finger and the middle finger, and in some people parts of the ring finger. It really does go through a tunnel in the wrist that's formed by the tissues in the palm and the bones of the wrist. And for reasons that we actually quite haven't figured out yet, the pressure on that nerve starts to get increased. And the number one symptom is pins and needles and numbness in those particular fingers. It's very similar to the sensation that you get when your foot falls asleep from sitting down or crossing your legs too long.
So is it really true that, you know, I'm going to flash back here with an old term, secretaries always used to get this because they were on the typewriter so much? Is that true?
A lot of the modern thinking is now that we think that that association first came about because as our understanding of carpal tunnel syndrome really began to develop, it's when computers were first being used very greatly. So we sort of made that association with it. More modern thinking is that as long as somebody's computer is set up properly, they have a good keyboard, they have a good wrist rest, people who type a lot in a good workstation actually may have a lower chance at getting significant symptoms from carpal tunnel.
Is there anything you can do? Do you need to do stretches before you sit down to the computer, or is it just make sure you're sitting right?
That's a great question. I would say that the number one thing is that carpal tunnel syndrome to me starts in the chair. So people who sit in their chair a long time, as you sit in it, it gradually lowers down a millimeter at a time, day by day. So the first starting point is really, I think, to adjust your chair. Make sure that your hands, your wrists, and your forearms are at a comfortable level to use the keyboard and the mouse. And then once that's done, you want to make sure that your forearms and your wrists are not resting on a sharp edge of a desk. Laptops are a big culprit because we keep our wrists right on the edge all the time. So as long as the chair is at a good height or that your keyboard is at a good height, and then you make sure that your wrists and your forearms are supported appropriately, you have a much lower chance of getting carpal tunnel syndrome or any of these repetitive strain issues that are coming up.
Good stuff. A lot of stuff I didn't know. Dr. Joseph Robison, orthopedic surgeon at Florida Hospital Kissimmee. Appreciate it.
Thanks again,
Thanks so
John.
much for your time today. I know you got a few more questions to answer there, so we'll wrap it up in here in the newsroom.